Nagaland's tally of COVID-19 cases crossed the 1,000 mark. A total of 33 fresh cases are reported from Dimapur, Mon and Kohima. The All India Institute of Medical Sciences begins human clinical trial of the indigenously developed COVID-19 vaccine today. And India see a record single-day jump of 40,425 COVID-19 cases, pushing its tally past the 11 lakh mark today. Number of recoveries also crossed the 7 lakh mark. Well, those were the headlines. Hello and welcome to this edition of News Broadcast from News and Trends. We begin this bulletin by taking a look at the COVID-19 update from the state. Nagaland registered 33 fresh COVID-19 cases today, taking the state's total infections by the virus above the 1,000 mark. State's Health and Family Welfare Minister S. Pangipom informed this in a tweet this morning, saying, out of the 454 samples tested, 33 positive cases of COVID-19 have been confirmed. The new cases include 16 in Dimapur, 12 in Mon and 5 in Kohima, the minister added. COVID-19 cases in the state has shown a considerable spike since the first case was confirmed from the state on May 25, 2020. It took nearly 37 days to reach 500 mark from 3 cases on May 25 to 501 on July 1, taking 19 days to cross that mark. The cases since July 1 have increased by 520 to reach 1,021 today. With the addition of 16 fresh cases today, Dimapur, with the worst hit district in terms of the number of positive cases, has now reported 404. While 163 patients have recovered, active cases now stand at 241. Meanwhile, with a patient from Eden Medical Center, Dimapur, testing positive, yesterday Deputy Commissioner Anup Kimchi has ordered the sealing of Shamrock Hospital and partial sealing of Nikas Hospital and Eden Medical Hospital. The patient's residence and neighbor buildings in Ward 18 Ziliangrong Colony, Dobinala, have also been sealed with immediate effect. In the case of Nikos Hospital, Dimapur, the intensive care unit, ICU and emergency ward has been temporarily sealed as per the DC's order. The ICU block at Eden Medical Center has also been sealed until further orders. The State Bank of India Bazaar branch in Dobinala and the SBI staff quarter, Block C at Bank Colony, Dimapur, has also been sealed after an employee who was recently transferred from Dimapur tested positive in Guwahati on July 17. Kohima's tally of COVID-19 positive cases climbed to 198 with an addition of 5 new cases today. 89 persons have recovered and there are 109 active cases. With the detection of COVID-19 cases from among 4 non-frontline workers residing in various colonies in Kohima, Nagabazar, D Block and Lower Chanmari colonies have been demarcated as sealed areas. Deputy Commissioner Kohima had issued an order demarcating the areas to be sealed in order to conduct contact tracing and contain the spread of the infection. All movement of person vehicles within the defined sealed area is strictly prohibited and under active surveillance, the DC stated. Mon's tally of COVID-19 cases has now reached 95 with an addition of 12 more cases today. A total of 8 persons have recovered from the infection and active cases now stand at 87. While cases in most of the districts remain below the 100 mark, Kifri is the only district in the state that has not reported any COVID-19 cases so far. As per the data provided by the Department of Health and Family Welfare, the state's tally of total positive cases now stand at 1,021 with 445 recovered and active cases at 576. Recovery rates stand at 43.58%. Meanwhile, State's Health and Family Welfare Minister S. Pangipom also tweeted to inform that he has tested negative for COVID-19 today. He tweeted saying the results of the test came out today and that he will be discharged from the facility quarantine center today. However, all necessary precaution measures will be strictly adhered as per the SOPs issued by the government, he added in his tweet. India saw a record single-day jump of 40,425 COVID-19 cases, pushing its tally past the 11 lakh mark today, while the total number of recoveries crossed 7 lakh according to the Union Health Ministry data. The death toll due to the disease rose to 27,497, with 681 fatalities reported in one day. The updated data at 8 a.m. today showed that the total number of COVID-19 cases stand at 11,18,043. There are 3,90,459 active cases in the country, while 7,86 people have recovered and one patient has migrated. The recovery rate stands at 62.61%. Maharashtra has reported the highest number of cases, followed by Tamil Nadu, Delhi, Karnataka, Gujarat, Uttar Pradesh, Andhra Pradesh and Telangana. In the northeast, Assam has reported 23,999 cases of the pathogen, 2,878 in Tripura, 1,911 in Manipur. Arunachal Pradesh has reported 740, Meghalaya has reported 450 cases, Mizoram 284 and Sikkim has registered 283 infections so far. The All India Institute of Medical Sciences AIIMS today began the human clinical trial of the indigenously developed COVID-19 vaccine candidate today. AIIMS Ethics Committee had given its nod for the human clinical trial of Covaxin. AIIMS Delhi is among the 12 sites selected by the Indian Council for Medical Research for conducting Phase 1 and 2 human trials of Covaxin. In Phase 1, the vaccine would be tested on 375 volunteers and a maximum of 100 of them would be from AIIMS. Healthy volunteers having no comorbid conditions and without a history of COVID-19, aged more than 18 years and less than 55 years would be eligible to participate in the randomized, double-blind, placebo-controlled clinical trial. The overall number of global COVID-19 cases has increased to more than 14.4 million, while the deaths have soared to more than 6,05,000 according to the Johns Hopkins University data. As of this morning, the total number of cases stood at 1,44,98,178, while the fatalities rose to 6,05,886. The university's Center for System Science and Engineering CSSE revealed in its latest update. The US accounted for the world's highest number of infections and fatalities at 37,73,206 and 1,40,534. Brazil came in the second place with 20,98,389 infections and 79,488 deaths. In terms of cases, India ranks third and is followed by Russia, South Africa, Peru, Mexico, Chile, the UK and Iran. The other countries with over 10,000 deaths are the UK, Mexico, Italy, France, Spain, India, Iran, Peru and Russia. In other news, in Assam, the flood situation at the state is improving as there was no heavy downpour during the last 24 hours. The death toll has risen to 84 so far. Over 25 lakh people have been affected in 24 districts. State and national disaster response force teams are carrying out relief and rescue works. In all, 1.21 lakh hectare crop areas are submerged due to flood. Chief Minister Sarbananda Sonowal visited the flood-affected Barpeta and Nolbari districts. Sonowal said that the Prime Minister has assured all the help to the state government to face the situation.
आज इस संकट परिस्थितियों का साथ असम की जनता को मुकाबला करने के लिए हम लोग मदद देते आए हैं। असम की बाढ़ और भूकंपाव ने इस बार काफ़ी नुकसान किया है और कुल मिला के 70 लाख लोग इस नुकसान का सामना करना पड़ा।
Deputy Commissioner Dimapur Anup Kimchi convened a meeting of the Dimapur District Task Force members today and deliberated on the matters pertaining to COVID-19 pandemic in Dimapur District. Expressing concern about poor section of the society who could not afford to buy disposable masks daily, the meeting decided for manufacturing washable cotton masks in collaboration with women group, police and civil societies to be distributed free of cost. In the meeting, the Deputy Commissioner emphasized on the need for proper disposal of medical waste generated at home so as to avoid spread of COVID-19, and for which DMC were entrusted for devising a special mechanism. The members also recommended to the higher authority for TrueNat testing in all the private hospitals and also for antigen tests to at least the high-risk group of people. While informing that doctors were working for contact tracing to avoid community transmission, the DC appealed to the citizens to always follow the guidelines to stay away from the virus. The meeting further decided that shopping timing would continue from 9 a.m. to 2 p.m. and appealed to the shopkeepers as well as the shoppers to adhere to the lockdown guidelines. It also cautioned that shopkeepers and public who do not wear masks would continue to be penalized and defaulters who repeatedly flaunt the guidelines would be taken more stringent action. Deputy CMO Dr. Antoli reminded that it was the responsibility of one and all and the colony village elders for creating more awareness and to follow up the programs. She also felt that we need to adapt to the situation and change our lifestyle by maintaining social distance, wearing masks and following hand hygiene besides being vigilant. In the meeting, members including Director CIHSR Dr. Sedevi, DCCI officials Shikto Achumi and several others felt the need for continuing extensive community training for creating social awareness. The meeting decided that the training programs conducted in collaboration with CIHSR would continue and announcements through PA system would also be intensified, covering the colonies and villages. The meeting was attended by Commissioner of Police Dimapur, DMC Administrator and all other members of DTF Dimapur. Deputy CMO Dimapur Dr. Antoli today said that the OPD and other medical services are still continuing and has not ceased to function because of coronavirus. Dr. Antoli said this during the District Task Force meeting today. Informing that the government has a policy not to stop immunization, she informed all the colony village leaders to convey the message to the wards to avail the required vaccines. Presently, the OPD services are functioning from Urban Primary Health Center Duncan Bosti and Burma Camp. Further, MS Dimapur Dr. Kashto informed that ART Center is presently functioning opposite Fire Brigade, District Tuberculosis Center functioning opposite Supermarket, District Mental Health Program at Urban Primary Health Center and Oral Substitute Therapy at Supermarket Dimapur. The Working Committee, Naga National Political Groups, WC, NNPGs have condoled the death of 6 NSCN IM cadres who were killed near Ninyu village in Longdin district of Arunachal Pradesh by security forces. The media cell WC NNPGs, in a condolence message issued today, stated that the cadres were murdered in cold blood and that the Indian Army has by the very act transgressed ethical and moral treatment of enemies even though there is a ceasefire and political talks. WC NNPGs said the young men were slaughtered and the bodies were not treated with respect. It said that groups may be divided by nomenclatures, ideologies and political beliefs, but all are Nagas by blood, sharing same history, political right and one future. It said the working committee is deeply hurt by the slaughter of the 6 Naga youth. It also conveyed its deepest condolences to the bereaved families. That's all we have time for in this edition of News Broadcast. Do subscribe to us on our YouTube channel and also follow us on our Facebook page as well, and stay updated with the latest news from across the world, the country, the region and from the state as well. Meanwhile, stay safe, practice safe health hygiene and maintain social distancing wherever you are. But most importantly, take good care of yourself. Thanks for watching.